Hi, Kareem. Welcome. Hi, Slick. Welcome. Hi, Tombstone. Welcome. Welcome to the broadcast. How is everybody doing today? Happy Saturday. Hi, Dougie. Hi, how are you? How are you guys? So I'm just going to do a quick scope on autism and Lyme. Last night, how was last night? It was good. It was fine. I went out to a bar, but I have the light sensitivity issue, so I kind of have like an ongoing headache today. So, I don't, that's why I don't really like going out, because it's just kind of rough. Hi, PM Johnson. So, I just wanted to talk briefly about autism and Lyme disease, and just how they're related, and my personal experience with both, actually. A lot of people don't know that autism is also linked to Lyme disease. There is something called Lyme-induced autism, and it's basically, there are some kids that are autistic, and they don't respond to traditional therapies for autism, and doctors are starting to find out that some of these kids are actually infected with Lyme disease. So they have to be treated for Lyme disease apart from being treated for the autism. So thank you, Kareem. So Lyme disease can be an underlying root cause of autism symptoms. Informal studies have shown at least 20 to 30% of children diagnosed with autism test positive for Lyme disease. So that's a pretty decent chunk. My former Lyme doctor started off as an autism physician, and she saw that a small group of her autism patients were not responding to traditional autism therapies. And after going to a few conferences, hi Michael, welcome. And after going to a few conferences and researching the whole situation, she realized that that small percentage that was not improving had Lyme disease. Hi, it's good afternoon over here. Where are you from, Michael? So children with Lyme are generally more fragile and susceptible to injury or reactions from vaccines, environmental exposures, and infections. London, okay, so it's nighttime in London. It's about, what, a 9-hour difference from here to London, so that would be like 9:30 over there. So a lot of people think, vaccines cause autism, and it's not really that. It's partly genetic susceptibility and just sort of like a toxic load in your body. And these kids that are already susceptible to autism, and have Lyme, probably also have sensitivities to like vaccines and environmental toxins and things like that, infections and all of that. So that makes them especially vulnerable to becoming autistic. So I used to work with autistic kids before I became really sick and disabled. I was a substitute teacher for a school district, and I actually was often called to. Hi, Adriana. Welcome to the broadcast. I was often called to. Thank you for inviting followers. I was often called to work with autistic kids. Hi, Blanky. Hi, Gonzo. And I worked very closely with them, and I noticed some really interesting things. I know, yeah, it's a Saturday, so yeah, so you got me live today. I'm talking about autism and Lyme. This is going to be a really short scope. Something else came up, so I'll do another scope after this, probably talking about something different. But I used to work with a lot of kids that had autism, and now that I have Lyme disease, it's interesting to see the similarities in our symptoms. Obviously I'm not autistic, but it's just very strange to suddenly go from working with autistic kids to suddenly having some of their symptoms and realizing how hard it is to live with that every day. And they live with it all the time. Oh, thank you, PM Johnson. So a lot of things that I noticed with some of the autistic kids that I worked with was they had digestive issues, um, you know, gassiness, bloating, constipation, diarrhea. They were very reactive to certain foods. Hi, King. Welcome. They were very reactive to certain foods. There was one little boy that they would forbid us to give him juice, but if we accidentally gave him even a little sip of juice, okay, Slit Kells, artistic or autistic? Your teacher's wife has Lyme disease. Okay, yeah, it's a pretty horrible disease. Hi, Darius, welcome. So, I would notice that, that better not be a joke. Well, he put artistic. He put artistic, not autistic. So I don't know if he means autistic or if he means artistic. Marijuana oil. Okay, yeah, I've tried CBD oil. It didn't work for me. It worked for some things, but then it didn't work for other things, and it kind of messed me up a little bit. But different things work for different people. Typo. Okay. So, hey, Darius. So I noticed, they have food sensitivities, digestive problems. I have food sensitivities. I have digestive problems. So I thought that was very interesting. Even like a small amount of something, can set me off. Not CBD, Rick Simpson oil. Yeah, there's marijuana oil that actually has THC in it, and it'll get you high. But I don't like the feeling of getting high. It doesn't really do anything for me, or I don't get high the way that I should. Also, I've noticed autistic kids use it for your cancer. Okay. Yeah, a lot of people love the feeling. The first time I tried it, it was fine. After that, it was just kind of, didn't work. Hi, California Froggy. I always forget your name. Christina. Hi, Christina. Welcome. Some of the kids were sensitive to light and sound. I'm hypersensitive to indoor lighting. I'm also sensitive to sound. I'm sensitive to smells as well. So I think that's really interesting. My best friend had a brother with autism. Mom cares several kids with it. That's her job. Yeah, it's a very hard job. Very, very hard job. I worked one-on-one with a single autistic child, and it's very, very difficult. So I would notice sometimes that if I was substitute teaching for a special needs class, one of the sort of strategies the teachers would use to calm them down was to turn off the lights. And I found it, pretty effective in getting some of the kids to calm down. 32 years. I found it pretty effective to calm some of the kids down, and I think that that's really interesting. I mean, we don't know if maybe the lights are hurting them because some of them were nonverbal. The lights could be hurting them, or giving them a headache, or just accelerating their mind and that kind of thing. I know when I first started to become light sensitive, it hit me with a lot of fatigue, and then I was always disoriented. I could not focus on what I was doing. I was just totally out of it, and eventually I had to stop teaching because all the schools have fluorescent lights. Yeah, certain lights are really fluorescent lights especially are horrible. Yeah, sometimes it's sort of like, I don't know if it accelerates you, or it just for some reason gets your brain just running wild. And I start to look back, and I remember some of the most out of control days that I had with the disabled kids. It's like the lights were on all day. The cafeteria was a big trigger for some of the kids, and the cafeteria was loud, and it had fluorescent lights, and there were tons of different smells from the different foods. And that was always a huge trigger for one kid that I worked with. And I mean, sure enough, come lunchtime, he would have a total meltdown. So, I always wonder if that, if there's a link there. Yeah, like sensory overload. And I do notice that I get kind of bothered with crowds or really full parties and things like that. I just really, I feel very uncomfortable and very stressed out by it, Yes, King. It's a very kind of stressful situation for me. And, I used to love going out. I used to love going out to, clubs and dancing and the loud music and all of that. Yeah, anxiety. I have anxiety. Autistic kids tend to have a lot of anxiety. Movie theaters, I can't go to movie theaters either. Yeah, a type of social anxiety. Also, another thing I noticed was that a lot of these kids had skin problems. They would have rashes, or they would have like eczema, and that's another thing that happens a lot with Lyme disease. Meds for social anxiety. Okay, I broke out in acne. I would get eczema all on my legs, on my arms, and that's just something that I noticed, with a lot of autistic kids. They have skin problems, scalp issues, dandruff, and things like that. We reminded you to take your Paxil. So, I definitely think that there is a link. Some meds work. It depends on the person. I think it just depends on your condition, the severity of your condition, your genetics. There's a lot that goes into whether a drug is going to work for you or not. They're also like, I've noticed that some autistic kids are very susceptible to getting sick all the time. They would always have colds or upper respiratory infections, or something. They would always have something. And there's a lot of people with Lyme disease that get recurrent infections. Way back when, I used to get recurrent, I'm not autistic, no. I have late stage Lyme disease. I would get, upper respiratory infections or recurrent UTIs, recurrent gum infections, things like that. So, it's really weird, the similarities. Now looking back, I got it from a tick, yes. I don't know when I was bitten. I have no memory of the event. I don't know. I never got a bullseye rash, which they say is common. Hi, Ara. So I don't really know where it came from. A lot of autistic kids we already know have cognitive issues. Yeah, Lyme disease is very easy to get, contrary to popular belief. They have cognitive issues. They have neuromuscular issues. They have balance and coordination problems. They have issues with their social function. These are all things that people with Lyme disease also have. It can be fatal. It can be fatal. There have been a few sudden deaths that people did not know that they had the disease, and they just died. And it wasn't until the autopsy later on that they revealed that the heart was fully infected with the bacteria. So, I have balance and coordination issues. I was treated and I'm not fine. Some people don't recover. It's 60% of people. Right now the number is about 60% of people do recover. The other 40% have different challenges getting over the disease. So it's kind of, as far as being fatal, I think it's more fatal than people think. But the problem is that there's no proper way to diagnose the condition and to track how many people have it and how many people are dying from it. So I think as time goes on, there's going to be more, there's going to be better ways of diagnosing it and better ways of keeping track of the numbers of who has this disease and who's dying from it. Because I think right now it's just not being documented properly. So yeah, I've had balance issues. I used to have this problem where I would be putting like a cup inside a cabinet, but every time I did that, I would hit the shelf. Like I'm looking at the shelf, but every time I would put the glass in the cabinet, I would hit the shelf, even though I was aiming to put it on top of the shelf. So there's a lot of that kind of spatial awareness, and a lot of autistic kids don't have very good spatial awareness. That's what I don't understand. My bro was talking up to, he was about 7 or 8, then just stopped after. Yes, it can happen very suddenly. It could have happened... it could have happened if he got bitten by a tick, or it could have happened with a vaccination. Vaccinations don't cause autism, but there are people that are genetically susceptible. And when you have a vaccination, it basically, and that's another thing too. People with Lyme disease are not supposed to get vaccinations. We're not supposed to get vaccinations because we already have a load of toxins in our body. You know, the Lyme disease, other co-infections, any other environmental toxins. I'm very sensitive to like, you know, chemicals, things like that. I'm sensitive to like laundry detergent and stuff like that. So, you know, when you give a vaccination to somebody that already has a bunch of viruses and a bunch of stuff in their sort of weak, you know, dysfunctional immune system, then you're going to end up having, you know, another issue. You know, it's going to come out in some way. It's going to manifest in some way. And in children, it manifests as autism. You know, in adults, you know, Lyme disease can manifest as neurological issues, cognitive issues, you know, all the stuff that I just talked about, skin problems, digestive issues. And, you know, and a lot of that is also based on genetics. You know, I have bad genes. And that's exactly, yes, it's a person to person thing. You know, there's other people with Lyme disease that they do 6 months of antibiotics and they're good for, you know, 5 or 6 years. There's people that can't get through the first 2 months of antibiotics. And then there's people like me that get through all the antibiotics and are still sick. And I did go through genetic testing, and my doctor did tell me, she said, your genetics are not in your favor. They're going to give us a really, really hard time with treatment. And yeah, some people don't like eggs. So I actually didn't like eggs until I started eating organic eggs. Regular, non-organic eggs make me feel sick, which is really weird because I've hated eggs my entire life. It wasn't until I got sick with Lyme disease and my doctor said, you're going to eat everything organic, I started loving eggs. But they have to be organic eggs. The taste is kind of the same, but for some reason, once they hit my stomach, the non-organic eggs make me feel really sick. And that's just how hypersensitive I am to everything. You know, that's kind of what we were talking about, being sensitive to environmental toxins and things like that. So that's just, you know, a brief description. I know, now I want eggs too. Yeah, I feel like I crave eggs now for some reason. But they have to be organic eggs. I don't know why. I don't know what the difference is. I mean, maybe the antibiotics or whatever, I actually can feel them. I don't know. But that's just autism and Lyme disease. Yeah, organic eggs. Yeah, I swear by them now. I love organic eggs. And I used to hate eggs with a passion. I did not like eggs. So I'm going to leave it at that. I'm going to try to make this a short one. I'm going to come back because I need some advice. So don't leave me. I will be right back.